Hello and welcome. This is Dr. Jerry Cuomo. I'm here with another bonding case. This one is for lower splinting, lower anteriors. The patient presented with a lower incisor, and the tooth number is 23. 23 is now with much less bone, and he's presenting to four options. Was presented to him to wear a flipper versus having something that's more managed and fixed. So here are the X-rays on the case. This is the incisor, as you can see, um, and so there's minimal bone around it in the canine next door to it. Here it is from the other side. So the key is we know this is a stepping stone for him, but we like to gain some time here for him so that maybe he can develop a more of a long-term solution. Kind of keep his natural teeth right now before entering into any other more elaborate prosthetic phase. So we've done several of these successfully in the past. There is some maintenance involved. Might have a little composite to add here or there, but overall he already had a lingual composite added, but they didn't join all the lower anteriors. They just joined the three, and now it's separated from that. Air in the mirror, please. Our tissue wipe. So what we've done is we've made a jig, and the jig is right here. This is made out of blue blockout and from Ultradent. So this will service our tooth. You can see there are several alignment devices here. So the main tooth is in the center right here, right underneath here. Here's the canine and here's the premolar. Now I might add one more link to this side. I think I'll do that now. So we'll lower the light because it is light curable. Bring my bonding light over. And this is how we're going to add it. Just link it to the top. Transferring to my assistant. Curing light. And you can cure for about 10 seconds. It sets fairly well. It's blue blockout. It's visible light cure. It's good. It's a very versatile material. We're making a jig similar to making jigs for implants, where you want to try in several. You have a jig made to align them properly, then it saves you time. So time saving is important, working efficiently. All right, that's the last one we add, and I'm going to pop it all out again, gently, slowly. Scalar next. Good job with that. And we just gently pop it out. And that's one thing, I'll be careful you don't lock these in. That one's in an undercut, so we'll grind that undercut away. Am I hurting you at all? You okay? Okay. Close a little. It's kind of flowed in between contact region. Should come up now. There it is. So we'll just grind that away. It's just a small portion there. We're going to use a handpiece now. I'll just take a simple diamond burr. Light up, please. Thank you. And we'll grind away that little area that wants to lock it in sideways. We can now bring over the air, and we'll go ahead and dry this off, please. Thank you. Okay. All right. And we'll hang on to this. We'll be using this later. Now, next step is isolation. And we're going to use 2A clamps. These are 2A clamps. Wing clamps. We'll clamp teeth numbers 21 and 28 respectively. Okay. So here we go. Up, down, we're good? Good? Yeah, okay. Clamp goes in. Everything okay? All right. Next step, next clamp. Thank you. And now we'll reverse always the floss to the outside. Everything good? Okay. Slide ejector will be next on the left side. Okay, and now here comes our rubber dam material. Scissors. What we're doing is we cut a trough on the rubber dam, and right there's a little vent hole. Here's our 2 dots we punch and then connect that with a pair of scissors. There you go. I'll come in here. Now we're going to apply the rubber dams. And this will keep the lips and the cheeks out of the way, the tongue from getting involved, everything. Just until we clean everything off, get it ready for bonding. Okay. And we'll come right in with a plastic instrument, gold instrument or any composite plastic instrument. And you're just going to lift up the rubber dam and bring it around. Now, there's a little area here where we're going to add a 2x2 gauze with a cotton pliers. Correct. Okay. That goes in next. Up or down. Okay. You okay underneath? Okay, so that's gauze. If you feel like you're being gagged, just let me know. We'll pull that out. All right. Now we have everything isolated the way we want. Breathing all right. Scissors next. Yep. I'm going to pop a hole so it'll vent nice and naturally right here. All right. You got a little extra care. You okay? Okay. That's his tongue underneath. Okay. Now we'll take our handpiece. I'm going to use a small head handpiece. So we can get that next. Yep. All right. Let me pop that out. Small head handpiece. Okay. Let's see if that's better for you. Sounds like you had a little too much vacuum going on in there. Okay. Better? Okay. Very good. All right, folks. Here we go. And if that's too much for you back there, I can move it around. Want me to leave it out? Okay. Is it getting in the back of your throat? You want to sit up more? Okay. So we're going to change gears, folks. We're moving our microscope. We're just going to move our patient more upright now. He's feeling a little bit of resistance to the suction. And how's that? Better? Would that be okay? Okay. And you can adjust your headrest. Now I'm going to add a connector now to the microscope. I'll put in a number 2, and then we can go even more upright. All right, folks, just a few more seconds before we come back here. And pull the line in. Okay. And up we go. Okay, so right away we learn body position. It's important when you're using a microscope. We're using a chair-mounted microscope. So we're going to now change the angle to 20 degrees. Come from behind. Are you better now? Okay. We got a long appointment here. Bring it. Yeah. Okay. Chin down if you can make it. Perfect. Now I'm going to use a large crown and bridge mirror. Nicole, I'll need a large crown and bridge mirror, please. Thank you. Very nice. Here we go. So here we go. And now I'm going to go ahead and start removing the composite. Get rid of the composite. Now we have a jig, special jig made. Thank you. All right, here we go. 2.5-inch mirror. Bring your chin down a little bit. Thank you. So this is just composite we're removing. Everything good on the video? It's slightly out. All right, bring your chin down just a little bit more. Perfect, sir. Is that okay? Now this is all composite. And so once we remove that, that's on your screen. Yes, yes. Okay. There's our tooth. Now we want to prep all the surfaces and clean them all up before we remove the tooth. Okay, that's first thing. Continue the suction. Okay. Now we're taking off the remnants of the composite. Anything bother you at all? You're good. Okay. And you'll move and adjust your suction device. Thank you. Just want to make sure we get all the old stuff off. That's important. Staying consistent. Now we're applying, we want to create a little space, a little room. So sometimes we can take away just a slight amount of enamel to make a little more room for the rib-on material. There's a proper way to measure for that. Models have been poured and they're getting ready to be trimmed, and then I'll measure right off the model the exact length that we're going to need. In the meantime, we're trimming away the existing composite, cleaning it off the root surface. And now we'll use an Explorer, will be next. Long Explorer. And we'll take the long end of the Explorer. Long end of the Explorer, thank you. Thank you. Suction again, lingually. Right, and you can see how these teeth do have mobility, but the most mobility is right here on this tooth. All right, and now we've got, all of our work is going to be above the gum line, and then at the end we'll do some root planing, perhaps some cleaning of the roots themselves. So when they're stable, they're easier to clean. All right, makes sense, as there's a lot of proximal areas of calculus that can be removed and cleaned up, but we don't want to do it to mobile teeth. Okay underneath? Yep. All right. Now we'll suction again, and then the doctor will rinse. Okay. Very good. That's nice. Now I'm going to take a fine diamond. Fine diamond is next. We're moving in the proximal zone. And again, cleaning off the old composite. I will be using indirect vision now. And as soon as this tooth is good to go, we'll scrub it with cavity cleanser. We're going to use that. Now we're not going all the way to the premolar, we're just going to the two strong canine teeth, numbers 22 and 27. And then that should be sufficient enough for us. Again, we built in a jig, special jig. We may use some suture material, and for that we'll have our kit ready for us. Sutures will have to be dissolvable, so resorbable. So the patient is flying in from out of town, and so we don't want to be able to see him again, although if he does go back, he'll be in touch with the periodontist for any follow-up care he might need. I always say if you have any excessive bleeding at all, if you feel like you need to be seen, you always try a tea bag, put a tea bag in and bite down on it. Tannic acid is a good coagulum. Tannic acid. Okay. Then we're going to switch to a fine football diamond. And that fine football diamond will be small enough to fit in the lingual surface of the anteriors. Okay. Got it. Fine football diamond will be loaded. And now you want to just try to get all the kind of the material, bioburden material, and we'll do that next. Get it all cleaned off the tooth. So here's our football diamond. Again, we're not touching the incisal edge at all because we're going to be using our jig. We don't need to do anything up that high. We want the teeth to look like teeth when we're done and when we're finished. Now I may have to stabilize this one. Dental assistant will move. Great. We're just trimming, cleaning, getting the surface perfect. All right. The goal is not to remove keep as much tooth structure in position as we can. One tooth is in order to be removed. Once we remove it, we're going to be filling the back side of it. I'm going to ask my other dental assistant to go check on our models now, see if the model work is heated up now, and might be able to at least get them out of their impression by removing the alginate and tray on the model. Poured it up in silky stone from whip mix. You just check, see if they're heated up, Nicole. If they're starting to heat up. Thank you. All right. Cavity cleanser will be next. And just turn a little bit to your left. You doing okay? Seems like a better position now. It's good. Okay, now we're cleaning away. Look, he's got beautiful enamel. Thank you. So the models are warm. We got about 20 minutes to go on that. And so you can suction that again. And just keep suctioning. Yeah. And now he wants to swallow, so let him swallow. You need to swallow? Go ahead. We're good? All right. Okay, now gentle air with suctioning from the labial surface. So we'll put the suction out there. Drying off the surfaces. So we're going to continue. Any feeling at all? Scalar will be next. You feeling it a little? If you need more anesthetic, let me know. I'm going to check you too before we... You're good. Okay. Now I'm going to ask my secondary assistant for, again, some more materials. So we're going to need resorbable sutures at chair side now. Thank you. And a straight hemostat. Along with the straight hemostat. Thank you. All right, we've been at it, roughly about a half an hour to 40 minutes. Just going through the material. Meticulous cleaning now with a good sickle scaler that works really well for surfaces that are long and slender. You want to get a really sharp one in there that can remove the debris. Now we're not going too far below the gum tissue to stir up anything. We don't want any bleeding right now. We don't need any of that. once we remove the tooth, we will be placing our suture in there to stop any oozing. All right, so that's coming. But in the meantime, I'll stay above the gum line. We're cleaning off any material alba or any of the tartar. We'll also use some ultrasonics later as well. Okay. And so we're going to pre-measure our foil first. It's going to be foil. We'll do that with the kit. I'll need the kit opened up on my right side. I can ask for that. Suction again. All right, I need my ribbon kit open to the right at the mobile cart area, please, and new set of gloves out. Thank you. Can I get a 10-4, please? I might want to just hang around this here for a little bit, just make sure I get everything ready. Okay. Okay, so we won't, if we don't have straight right now, we'll go with curved. It's going to be all on the mobile cart brought toward me. Thank you. Sure thing. Doing okay underneath, Ellie? All right, sir. Wipe, please. Okay. Let's open it all up. Yeah, and the aluminum foil, that should be in there. Yep, that can be there. Yep. And it's a pair of scissors that can be left here. And that can be left here. Okay. That's good. That's all we need. Yeah, and a pair of gloves out should be in there. Yeah. Gee, 2 sets of gloves would be good. Thank you. We're all set here. Wipe again, please, and just keep going in this fashion. All right, I'll check the lingual. So our main concern is lingual. We do, if we have a chance to clean in between your teeth, we're going to take advantage of that. So now there should be some finishing strips in the top drawer of another room. You can bring those in. Wipe again. Kind of like we're cleaning teeth today as well as addressing restorative. Okay. Sorry for the noise. Wipe. Okay. All right. Okay. And can you ask Phyllis to help and assist? Thank you. It is gut suture, yes. You have it with you? Oh, okay. You're verifying that you have it. Okay, so gut suture is ready. We're good to go. Thank you. Thank you. All right, here we go. All right. We have cleaned a lot here, folks. A lot of teeth here. All 6 and 7 and 8 a little bit too. So water picking, we are advocates of water picking. A lot of Canadian studies now with water picking, especially around implants. But it seems like when you have a long day and you've eaten a lot of food, well, the last thing you do before you go to bed is water pick. Found out that the water tank that's used, you can actually place microbial agents in it. It will help keep these bugs from attaching to teeth, keep them nice and clean from the dental plaque, and prevent bone resorption, etc. Okay, let's do a little bit of ultrasonic while we're waiting for the next steps. I'm going to change this one for another one like that, a longer tip. All right. We're almost done here. You can see where that tooth's been adjusted already by the previous dentist, so we'll leave that alone. We're not going to touch that. So ultrasonics are used in dental cleanings for removing deposits on teeth. So we're going to use water, lots of water, and some vibration occurring here. Now there's, thank you, several surfaces. Clean around, staying a little bit above the gum line for now. All the ribbon will be into the enamel, not on the root surface, but in the enamel surface. Patient's going to be instructed on how to use proxy brushes. So we'll have them ready, dry. Proxy brushes and go-betweens for room 2. You can check with the hygienist, please. Thank you. All right, so now we're going to clean more around our tooth while we're waiting for the model work. We might as well remove calculus. So basically I'm just using the mirror for retracting. The other things that you can use are what we call super floss. And super floss has a long lead, kind of looks like you might be going fishing, you know, with one of these super flosses, but they work so well. Okay, so we're knocking off the calculus now. And getting some root surface cleaning. I just want to double check. Are you still numb underneath? Still pretty good? Yeah, not bothering you too much? Okay, I'm going to up the dose of your local anesthetic in a minute. Yeah, just staying ahead of the game. Going to get all the surfaces nice and clean. Okay, there we go. Bring your chin down a little bit. Thank you. So we'll have a little session at the end on how to take care of your fixed retainer and your lower anteriors. Okay, relax your lip as much as you can. I'm going to sneak around to the other side. And we'll use the mirror now to retract. So we're meticulously cleaning. We're not done yet, but we want to at least get a head start. We're waiting for that model work. We're probably up to about another 5 more minutes and we can pull and trim. Okay. And we'll still hold on to that. Now I'm going to do just like a 5-second etch. Just want to see if we got all the composite. I'm sure we got all the composite off, but I just want to be doubly sure that all the composite is off the back of the 3 teeth on this side. So let's ultra dry that. Okay, so just a quick etch. And we're also going to need a cut bands, 2 cut bands. We'll have 2 wood wedges, non-color. Have them available. Thank you. Yeah, just keep it nice and dry. I think we can still see some of that composite. So a little air on the tooth portion. Perfect. That's the key, is to get the old stuff off, and this way we've got a fresh enamel. Enamel bonds so much better than dentin, so take full advantage of it. We're going to be in the middle third of each tooth, middle third. Strong pillar tooth here, don't need to bond any more than just the canine here. Come right on over to the lingual of each incisor and then all the way to the other canine. Okay, we got a nice surface. Okay, cleanser will be next. Finishing strips actually will be next, so we'll go with those. Okay, so these are diamond finishing strips. You want to clean in between the teeth. Everything good? Still swallowing? Need it? All right. Yep. Okay. You're welcome. We'll finish down in here. Finish it down in here. And again here. Anywhere you can increase the bond strength, you want to clean off that portion. And here. Teeth are mobile enough to allow the device to do what it's supposed to do, cleaning off any calculus, tartar, mineralized plaque, bioburden. Right. Okay. And that's as far as we're going. We're not going past this mark. My dental assistant will rinse gently and this dried thoroughly. So I'll have my patient turn to your left now. Okay, and now she's drying thoroughly. And what we're looking at is the surface texture of the teeth. We're doing a good checking of that. And you can see there's meticulous surface now. Again, I'm just going to check with just 5-second etch. Just a little spot checking here. 1001, 1002, 1003, 1004, 1005. Okay, now we're rinsing. There we go. Now I'm going to check it. All right. Gently take him out of the alginate, and you can trim it flat at the base only, so I get a flat base, just something so it would settle for me and not rock on a countertop. Thank you. Okay, so we're good to go. We're going to give more anesthetic, and while that's taking place, we're going to be measuring off of a model. So more anesthetic is coming. Same type. I'm going to just move our microscope up a notch to 5 degrees now. And now we're a little more in focus. Move this around. And we'll drop down the chair. Okay, decap. Tissue. Okay, so we're going to give some more anesthetic here. that okay? Dental assistant will have the suction ready. Oh, we're going to get our suture out and ready too. Well, we won't open it up yet. We're not quite there yet. We're going to measure our material first. And so he doesn't feel anything. You doing okay? Alright, and now she'll rinse that thoroughly. We're going to start to measure. Now this is the kit called Ribbon. Company loves me for doing videos. So what we're going to do is change gloves and then go right to the foil. Foil is going to be measured exactly, not only the length but also the surface length of the teeth. So you're not just going to draw a point A to B. You have to actually push it up against the teeth. We'll do that on the model. I'll show you how easy that's going to be. So I'm going to cut out a strip. Now the Ribbon material comes in various thicknesses, so we're going to use this thickness. This is our 2 millimeter thickness. 2 millimeter thickness is a good thickness to use. Very good material, and you can see that's going to be duplicated. You can also use 2 strips if you want, but 1 is plenty. That's all you really need. So now we're going to cut out a strip just to pre-measure. Show you how we do that. It's very malleable. In other words, you can burnish it up against various convoluted surfaces of the lingual surface of the lower incisors. Cotton pliers will be next. Alright, and my dental assistant now will suction away any debris and any of the exudate there. She'll rinse it off and continue to rinse. And then she'll dry it all thoroughly, and the incisal ledge as well, up in here. And we'll put a pointer where we need some air right in here. Alright, taking a look there. Looks like our surfaces are perfect. So we can now start the pre-measuring. So you can see this is more than enough. Right now I don't want to go in vivo, I want to go in vitro. I want to go out of the mouth. I'm going to try it on the model. Well, we could do it in the mouth. We certainly could do it in the mouth. This takes more time, but we certainly have done it that way. I'll deglove again. Right now we're up to about 38 minutes since we started the recording. About 38 minutes in the chair. Things look really good. Cotton pliers here. And all set for the lower model, please. So we'll get that model back to us. Yeah, just to lower. That's all we'll need right now. Thank you. Just to lower, please. Thank you. You can lay it here. Thank you. Very nice. Thank you very much. Okay, so we want to burnish this. I'm going to just show you guys what this looks like. So let me have like a gold instrument would be great. So here's our model, and we'll dry it off. This is just to measure the foil. We don't want to do anything else. Now you notice there's some issues here. We can trim that off the model. Let's do that. We'll trim it off the model. My dental assistant is going to suction while I'm trimming. burr block, please. I have the cotton pliers, burr block. Alright, for now, maybe later. Okay. So this is just going to be done behind the patient. We're not going to do this intraorally. We want to trim away this extra model material. It's just in the way. It's the old composite. We want to get a true measurement. Nice pour-ups, Nicole. Yeah. Alrighty. We got one little hole there, but I'm not worried about those. Those are on the incisal edges. We're more interested in right here in the middle third. Middle third of the lingual surfaces. Middle third. Best place to place the rib on. Now I'm going to switch to a smaller burr and then we're good to go. Type of composite we're going to be using today, it's Charisma. Color will match the existing dentition. Or lighter. We'll make it blend so that no one will see the color changes, and do that with a shade guide first. Beta shade guide. All right. Okay. That looks good. Now we dry that all off. Now we don't want to transfer any of any issues here, any of the model grinding, so we're going to take a tissue and just kind of wipe it off. Okay. And then we dry it again. Okay. Next step, we'll take a gold instrument. And you can see you can just take your fingers and just put it right on up to it like this. Start on the canine one side, gold instrument. As you're pushing into the proximal area, it follows to that area, okay? So hold it with your thumb, push it in, hold it with your thumb, push the other end in, continue the path, and as you're turning the corner, you hold that area that you just pushed against the model. This way you're getting the true measurement. Okay, so when everything is done, said and done, you just take it all off, stretch it out. That's your length. Okay? Start over again. So I'll just double back, double check. If you got fingernails, this is where it does help a little bit. You can push it in the inner proct, otherwise use an instrument. Then your thumb goes there, holding it, instrument goes in, middle third, that's all we have to worry about. Same thing here. Burnishing it to the middle third. Finger goes there. Now we're in the home stretch. Alright, that's pretty close. It's a good estimate. It's not perfect, but it's a very good estimate. 99.9 is close. So there you have it. There's the length, overall length. We're not going to put it in that exact position because we want to carry it up to the middle third, but that's close. So now take it. You've created this line here. You're going to take your scissors. And you're going to stretch it out. I have it in my hand, and my dental assistant is going to just put her hand underneath to catch it. All right, Heather, you got it. There we go. And we're just going to cut it like that. All right, so we know it's going canine to canine. Now I'm going to stretch that out. I'm going to actually take it back. But before I do that, I'm going to put it back on the model. Triple jack. Cotton pliers will be next. Okay. And it's flipped around, so we'll go back the other way. There we go. I'm just following the guidelines of the book. Here and here. And that's perfect fit. Okay. Cotton plier again. And you're going to grab and take care of that. Stretch it out. You know, you don't have to overstretch it, just enough so that you can now measure your piece. So here we go. A nice brand new setup here, 2 millimeter length. Now the next part, you won't be able to really cut this with anything but the pair of shears it comes with. Kevlar is pretty strong material. I just want to make sure I don't have a frayed end. That looks like a decent end there. I think we'll be okay. But I may end up just trimming that. Take the burr off of that, please. Thank you. Okay, so hand underneath again. Thank you, please. Catching the material. Nice catch. Okay, now we're going to measure, hand underneath again. Okay. Okay, we're getting there. Slowly but surely. Here we go. Hang on to that. That's lined up perfectly, just like that. I'm good. Okay. So you grab the pack below, and I will trim it. No, thank you. Just hold it down. Turn it. Hold it like that. Okay. Okay, that's fine. Hold there. I'll take the cutter. All right, we're good. Now we have our piece. Put that in a safe place. And again, if it's too small, too short, we just cut another one. We can measure this one now, so we'll take a measure, bowling gauge. We can measure it. We'll have time to do that. So safe place, a container of some sort. Okay, nice dry area. Move this and that. Great. Save that piece. Put it away somewhere safe. Now we're going to return our patient. We got to work now on an etching, but we're going to pick out a color. All right. And A2 looks good. Let's look at A1, excuse me, A2. So we'll go A2 next. A2 is too dark, so we're going to stay with A1. I think we'll be fine with that. Nice color. Go on the back of the teeth. All right, so next step we'd like to do is get our tooth set aside. We want to clean up this tooth. That's the next business now, next thing we have to do. So let's do that. And I'm going to check the surrounding surface with the gold instrument. Again, it's just a plastic instrument. And just let me know if you feel anything at all. Does that bother you at all? No? Okay, so he's anesthetized. So if that bother you at all, okay. So I just keep checking with you. I'm just going to go in and that you can feel? Yes? A little bit? No? Okay, so we're going to do surgical suction tip, white. Surgical suction tip, white. I'll get the 2x2 gauze. Okay, so she's going to come in and put it right on the button. There we go. And a little bit back in here. There we go. Grab that. And there. Yeah, that's good. Maybe there is good. No. So now I'm just going down to get away this little fibers that are holding this tooth into soft tissue. Keep the suction in there. Great. While she's keeping the suction in there and controlling the feel, I'm going to go ahead and get the suture material out and ready. Now, the way I like to do this is I get it out of the package and just have it out, but I might trim it a little bit. I might trim the suture material just a little bit so we don't need all this room. This is chromic gut, so it will dissolve on its own. And we're going to use the curved hemostat this morning. And our scissors here. We'll leave that right there. All right. So again, number 23, lower lateral incisor, separating now it from the group. You doing okay? Yep. Anything tender at all? You're okay. Okay, and it's just pressure only. And we're staying away from the adjacent teeth on any record. We're just going and moving it out like a small little peg. It's coming out slowly, gently. Now we're down to sound bone. Lots of bone on the canine side, less on the other side. Gel foam collagen, Phyllis, room 2, please. Gel foam collagen, room 2. Okay. We'll take a hemostat and just kind of, as I remove it, my dental assistant will go in and stay in the socket. Secondary hemostat, curved, room 2. Secondary hemostat, curved, room 2, please. Over. Thank you, ma'am. Yep. Yep, same thing. Thank you. Okay. Okay, so we're preserving as much of the crestal bone going around the tooth. Okay, awesome. And then we need a spoon excavator. We have that. All right, very nice. Now we just gently remove our tooth, concentrating here, as we want to keep it from chipping or changing in shape. All right, doing okay? All right. Now you'll suction the socket and just stay in there. Keep it parked in there. I'm going to have it come out. And now we're going to rinse this off and come right back on in. And I'm going to use a burr to clean the surface from any of the contaminants. All right, so, and probably an ultrasonic as well. So we're just debriding right now. And I'm also checking to see if it's got any fractures in there. I want to make sure. So she's going to run a little bit of water in there right now just to kind of clean things up. Maybe a wet 2x2 would work in there as well. But her main job right now is just to keep it under control. That's the key. Keep it under control. I'm going to change my gloves. All right. Walking back. And we're going to all look at this tooth now. And Now the key is to round the tip and add some composite to it. So we're going to do that next. And then we'll etch the overall portion of the tooth and get it ready for bonding. So it'll set aside. I'm going to ask my other dental assistant for a box, a lab box. I'll need a blue lab box or a white lab box for room 2, please. So now we're going to look at the tooth. And here it is. So there's the calculus on its side, a little bit of periodontal ligament that comes off fairly easy. And there's the soft tissue, there's the nerve ending, that's the apex. So we're going to go into that apex and clean it out. So we'll take the scaler and actually go in and remove the calculus. In your hand, wouldn't that be great if all teeth were like this? It's not the case. Alright, so we can get most of the calculus off here, and then we'll go in the mouth and do the same thing. Now you can take right now you can actually put a cotton roll and put some pressure down in there for now, while I'm doing this. So you suction it out, put the cotton roll in there, and just kind of push down a little bit. You doing okay? Great. It's just scaling off the calculus. Now I can use an ultrasonic without any water just to get it cleaned off. There we go. And we're just cleaning any surfaces from debris. Okay, now we're at the tip of the root, and we're going to do a little prep in here, all right? Do a little tooth preparation. Going to do that with a 1/4 round burr, right? So we'll take a slow speed 1/4 round, or a super fine diamond, a real thin super fine diamond would be great. Super thin, fine diamond, 1/4 round. Fresh 1/4 round. Okay, super fine is here. Okay, okay. All right. Got a fine diamond is ready. Let's see if we can do it all with this one. Perhaps we can. There it is. So we're going to go right in here and do a little prep. Let's estimate a certain distance. Oh, I locked it in there. Because we do want to round this off, so let's do the rounding first. So I'm going to estimate about 2 millimeters of rounding. So my dental assistant will suction to the left of us. All good? Come right on in. It's just an estimate. Getting it nice and rounded. Okay. I'm almost ready for another glove change. Now we'll polish this with a cup. Any color cup will be fine, just something to smooth it off. And then we'll put that little bit of preparation in the middle where our flowable composite's going to go. All right. And we'll go a little deeper. And we'll flow that composite down in there, and then that'll bond to the walls. All right. So we'll dry that off. I'm just going to change my gloves real quick. And we're getting ready to do an etch bond technique with flowable composite. So etch, no primer necessary. Go right to a dentin bonding agent. We're going to use 3M today. And I'm going to pre-check the diameter of that apical prep with a periodontal probe. So those are the next steps. All right, so we're going to polish with a cup. All right, and just these are cups that we like to use from Rassler. And that just gets the surface nice and smooth. All right. There we go. And it dries out a little bit, so. Well, we're going to use bonding in there, so that'll keep it all together. There's absolutely no pressure on the apex of the tooth. It's all going to be on the incisal edge, this edge. So we're not touching that because we made an index, but the apical portion we are. So here we go. Actually, I'm going to take a little bit more off. Alrighty. We don't want to leave it too long, not too short. It's got to be kind of like just right. So you want to make it so that it's got a eggshell or convex surface. All right. And I'll just drop in again gently. And we'll blow some air now. And just drying it off. Okay. And blow continually with the air. All right. Now we'll measure with the periodontal probe. Periodontal probe. And we'll check it. Yeah, it's a good length. Polish it some more. And we're ready for the etch. We're going to go etch next. Drying it off. Okay. And you can see it's already bubbling up, so that tells you right away we are right on target with our etch and our clean surface. That's carbon dioxide, up or down. Transferring. Got about another 5 seconds and we're going to rinse it off. Got a cotton roll in place over there. Yep. Okay. Suction that right on top of it. Stay right there. Okay. So turn it upside down. Okay. Good. Right. There you go. I'm going to use a micro suction tip because sometimes water gets in there and you can't get it out just by drying it, capillary pressure. So we're going to use a micro suction tip. Okay. Okay. All right, so we're ready for the microsuction tip. Okay. Everything on? Okay. Okay, we're good. Now we'll lower the light. We're going to add the dent and bonding material. Okay. Periodontal probe or Explorer. Actually, Explorer will be good. We'll push it down inside. We'll use it again. More material. Transferring. Alright, looks like our patient might be falling asleep right now. Now we're going to lightly dry that. Our microsuction there. Microsuction would be good. Okay. Alright, there you be. Syringe. Air syringe. I think I'm going to leave this on my side for now. We can leave it over on the bracket table or put it up. I'm going to like cure that. Flowable will be next. Then we're going to go through the process again. We'll do the entire lingual and proximal surfaces, all etched and painted again. All right, here we go. I'm doing it this way so I can just handle it. My fingers. Flowable is next. Explorer is next. Now we're just filling this up with flowable. There we go. All good. Make sure there's no air in there. Actually, I'm going to need a smaller syringe. So inside the composite box, do we have it here? I need the flowable inside the composite. Just need, it comes with a smaller blue tip. So we'll use a light blue tip with that. So a light blue tip with the syringe. So the material's in the composite kit. It's flowable. Any of the above. And just put a blue tip. Color's not important right now. We won't use the blue block out. We just want to get composite. Okay, thank you, ma'am. Great. Are we good on that? All right. Now we can sneak it in there. There we go. Okay. He hit the, you'll turn it on. He must have hit the screen. Let's making sure we can throw this away. I'll wipe the excess off. And then we'll cure it. Curing. 20-second cure. And now we'll finish the polish with a red rubber cup. There we go. All right, and then we'll change gloves again. Okay. Polishing. And we got a really super nice surface, all polished. Now I'm going to change gloves again. And we're going to do the other side of the tooth. And we're looking at now right about an hour and 9 minutes. So last time I stopped and looked, it was 38 minutes. Boy, time flies when you're having fun. 109. Here we go. All right, tooth ready. Here we go. Etch next. Okay. Got it. So now we're going to do a 15-second etch. Brush is next. Large. Good to go. All yours, all mine. Okay, I'm just spreading it liberally, making it wrap around to the buccal. Transferring, now we can rinse. Okay. Okay. Now we're going to use a air syringe. I don't trust these syringes with water to them, so we have a air syringe. And now we're going to add to this our bonding agent. Here comes the bonding agent. And we'll just apply that liberally to our tooth. Transferring. Lightly drying that now. With thinning down, we don't want pooling. We get best bond to that. All right, so there's the man of the hour right there. It's time to get that luted in place. We're going to do that. Like I said before, we have a jig. We'll be putting it in the jig, sliding everything into place, and then bonding it. Do a temporary bond in the proximal zone, and then take away the jig, and we can finish the rest with the ribbon material. But we can't put this away. Got our bonding material on there. We're going to put it somewhere safe, like a little toy box, okay? Little lab box. And dump that. No, actually keep it. Yeah, keep that in there. Keep that in there. I don't want any contaminants on that. And this, we'll use visor seal for that in a little bit. I can just leave it there. That's good. Here we go in the mouth. All right. Now we're back in the proxy, in the orally now. Now we got to clean up our site. So the light can now come up. Dental assistant switching suctions back to the regular suction. Time to use Cavitron with full water capability. There we go. Getting rid of that calculus immediately. I can see it. Boom. Take it out. Clean it. Get it out of there. Over on the other side. Shift a little bit. Slide all the way down. Boom. Clean it out. Maybe we can get some bone fill back in there if we clean it all the way down as far as we can. There we go. Now we've got to curette that socket out. We'll do that next. So we're going to use a spoon excavator. And now my dental assistant is going to switch now to the other suction tip. It's called the surgical suction tip, white. Ask, got it? Ask for it. Surgical suction, room 2. Surgical suction, room 2, white. I'll take the gauze. We got it. Okay, suction in. Stand by, secondary assistant, just in case we need you. Thank you. You can glove up, come to my right side, suction again. Okay, go right in the socket. You have good room, good see. Okay, stay right in there. I'm going to take a look downside, see if we miss anything. Should be a suture right there. If you can grab that suture and the scissors right here. No, you're suctioning. Nicole, could you get the you can get the suture, please? The suture and the scissors, please. Thank you. And then open this up and a cotton plier. Awesome, girl. Go right in there, Heather, as far as you can. Okay, thank you. Just getting it all cleaned out. Yes, thank you. In there more. All right, good. Tell me when you're ready. Okay, let's bring it over here on top of the table. Scissors next. Suction. Yeah, just stay in there, please. Okay. Saving it. Okay, I'll put this one in. About the same. Okay. So this is a gelatin plug. You can suction again. Right in there. And good. Put that right in place like that. There we go. Suction that out. Got a little foreign body there. Don't want that in there. Out. We'll just change it out. Use the other one. Suction in there. Just check it for foreign bodies. We're good. This one's clean. Okay. Okay. Suction, please. Stay right on top for me. Thank you. That's good. Now come out. Okay. Gonna keep our plug in there. Okay, ready for suture? Okay, you hold on to the scissors when I need it. I'll let you know. Thank you. Okay, we're gonna back up. You're got a suction behind. Stay on the stay on the metal. That's good. All right, here we go. So we're gonna do an interruptive or a cross suture. Gonna come all the way in. Suction by my finger. Okay. Coming out. Gonna pull it all the way through. Leave a tail. Now we're gonna come through from the same side. We're gonna crisscross. We're gonna come right on over the top. It's called a cross suture. So we'll use the same angle. And then we'll do a triple knot, all right? Triple knot. There we go. Cotton pliers available. I'm ready. Now I'm going to go further down. Take a big bite out of the soft tissue. Dental assistant will come around to the facial, and she'll hold right at my thumb. Stay right there. Right there is good. Okay. Okay, so I'm coming over the top like that. Okay. Suction right on the needle head, right there. Out. Okay. Okay. I'm going to protect everybody because I have the needle here. Once, twice, 2 throws. Grab the end. I'm going to pull a little bit more through for now. Suction the top gently. Actually, you know what we can do now? We don't want to take that plug out. We want to keep that in there. You can just get a cotton roll. Cotton roll. Okay. And just make it small enough so that it can fit in there. And Heather, you can take it and push it in place while I'm suturing. Please do that for me. Thank you. And take it out now, just dabbing. And we want to also mind the other side as the suture. So you keep an eye on that. And we got to locate our end. Okay, and I'm going to pull it through. And we want the suture material to lay flat. So now you want to wet that cotton roll. And you're not supposed to over tighten. We don't want to tighten it wildly. We're just going to go in and just, again, you're going to keep that in there. That's good. That's good, honey. And you'll absorb some of that. See, it's already absorbing it because it's wet. Or damp. It really should be just damp. Now I'm going to do reverse counterclockwise. And then we pull it again. And now everything is kind of drying out, so we got to keep the ball rolling here. Okay. Pull this through. Okay. So we'll just rinse that gently. Moisture on it. See if that frees it up. If not, we'll do a new suture. Let's get a new suture. Scissors are next. So it dried up on us, folks. So we've got to figure this one out. It's kind of dried up on us. So silk would be nice, but we don't want to give them silk. Dry. Oh, we just freed it. Looks like we freed it up. So we're good. So reverse once. Okay. There we go. Now you can suction around the front. And we'll throw one more throw in there, one more knot once. Couldn't locate our straight. He missed that today, so we got through this. All's good. Now we can tie that off and now trim it with the scissors. Now I'll trim it about 1 millimeter from the knot, maybe 2 millimeters from the knot. That's about all you need. Now that's going to hold the plug in nicely. And we'll take a gauze now, just regular gauze for doctor. Okay, and I'll wet it. You can take the needle out of there and put it off to the side. Very nice. Okay, now the key is to get everything clean. So that's the next step. Rinsing with my dental assistant on my left, suctioning with the large suction. Large suction. Thank you. Great. Now we'll take a fresh piece of gauze from my secondary assistant while my primary is suctioning. Suctioning, please. Please suction. Thank you. Okay. All right, looking great. Looking great. See how that covers that piece? It holds it in place. That's what we want. And now I'm just going to go in and wipe everything. All right, now we're ready to etch. Next. Ready for etching. And need a large brush and another etch. We're out of etch, so all out of blue etch. Brush I have, you have. Etch we need. Now I need those cut bands. So we'll look for the 2 cut bands and the 2 wedges. So we have 1 wedge. Do we need another one? Yes. 1 wedge. We'll need another secondary wedge. No color. Wood. Wedge is next. Transferring with a cotton plier. Alright, so we'll put the wedge in there. Secondary, we're going to go to orange wedge now. Orange wedge. Yeah. A fit issue. 2 can go right there. I'll pick them up. Alright, very nicely done. Thank you. And it goes. There's one. Now we're putting in these metal matrices. So we don't want to etch the adjacent teeth, so we'll keep that off of them. Now we can use the etch, and the brush is ready here. So here we go, folks. Etch is going on. So we're counting right now at 15. My dental assistant is counting for us. And once that starts, she's going to be rinsing the first tooth off slowly. Actually, I'm going to hold off on rinsing. Let me get on here. And I'll use the brush to move it around. That's what I needed to do. Front and back. Okay. And now we're good to go. Okay. Okay. Just making sure none of it gets on the pink tissue. And what we're going to follow this with is a dry air syringe. It's got no water that goes to it. Alright, so that dry air syringe, now she'll just follow me around. Getting, you can grab a dry 2x2 gauze. Dry 2x2 gauze, great. Continue to suction in front of the gauze. Okay, and I'll take a cotton roll, just one cotton roll. Doesn't have to be anything special, just a cotton roll. And we'll put that in place. Cotton roll, doesn't have to be special, we're good. Now we're going to take, the next step is to add the bonding agent. So that's next. Large brush with that, please. Getting close to the finale, folks. Getting this one done. Okay, large brush, got it. Pre-dip, please. Pre-dip, okay, good deal. Lots of material there, terrific. All right, here we go. And I'm going to do it in segments. So I'm going to cure these two teeth first because they're next door to the little area. So I'm going to thin it down and transfer that, thinning it to the gauze, keeping the oozing under control, and clicure. Alright, so you see some oozing. Hopefully that just stays down below. We've got the suture on top, the cross suture doing its job. Over on top. We'll see, we may add one more suture. We'll see what happens. I'll just make sure I have one more suture available, not open. Okay. Yeah, thank you. Okay, thank you. Just a fresh one. Okay, now we're going to add more material. Transferring. Pre-dip. Okay. Thank you, thank you. We're double covered. Like double coverage. Okay. I'm all set. Suction lingual. Thank you. Another gauze, please. Okay. Light curing. So we're controlling the site. We're controlling the site. We know we've got a suture on top. I think it's going to move aside as we move the tooth in position. I believe the suture will do that. But we're going to bond our tooth now, and before we place the ribbon in there, we're going to bond our tooth in there, just from the labial, and we'll remove that bonded material. Yes, we will. Okay. Surgical suction. Ready. Light up. Good. Changing gloves. Okay, so our gloves are changed again. Coming in now with our tooth, all etched and bonded up. And now we're going to lower the light. Insert our tooth, and we have our seating instrument. Come on over here to the seater. Place our tooth in position. Okay. Let's see how that goes into the jig. Let's see if we got the right one. Here we go. Yes, there it is. Okay. All right. That's in the right position. Okay, so we want to lute this with just some flowable composite. Same flowable composite. No, that's okay. We're good. Yeah. Follow it with an Explorer. Explorer ready. Explorer. Light ready. Transfer. Shields up. Okay. That's it. It's in the right position. How we lute that. That'll come off. It's easy to remove. It's on the facial. It's not going to interfere with another tooth. Okay. Staying put. Back in the mouth. I'm going to transfer and lute it in the mouth. Now we'll take these away. Cotton plier. Okay. Cotton plier, okay. 1, 2. Alright. Now we've got to get this in. Light up. Thank you. Now I just push it in place. Wiggle, wiggle, wiggle. Wiggle, wiggle, wiggle. Pushing it down. We've got that plug in there. Pushing it down. And get it snapped into place. Mirror is next. I just want to make sure we're not bumping it. It looks like we are, so cotton plier. And we'll get this out. And push it down the rest of the way. Let's see, mirror next. It's hitting right into the, I have to relieve it. It's hitting into the retainer. So I'm going to relieve it. Out we come. Almost ready. Gauze back in the mouth. Gauze in my hand. Trimming. Large suction. New burr. Trimming. So this is where the rubber dam clamp was in the way, so I'm going to trim that away. Okay, that's that. Hopefully that's all we need. Let's just trim a little away from the inner prox. Now we're going to dry all that off with our air syringe. Air syringe here. Careful, don't bump into our tooth. All right. Hopefully that's all we needed to do. You know, I'm going to change my gloves. I think we need music in the background for this one, folks. This one's just hearing my voice and the procedure might make you want to sleep a little bit, like our patient. Definitely not our assistants. They're wide awake. Just kidding. All right. No, my foot is not falling asleep. We are doing just fine. All right. Back at it again. We're just going to do a little house cleaning here. And we'll take a gauze for the doctor. More gauze out and ready. We're going to get rid of some of this stuff here now, just kind of taking charge of the location. All right. And now we'll dry that all off with our special air syringe. Okay. And I'll just take simple, small micro brush. Looks like we got a few fibers that wanted to gather. Okay. So we want to keep everything to a dull roar now. Yep, all decontaminated well, doing great, doing great. We'll take one more of those guys. All right, yeah, I'm just gonna stay away from any more cotton for now. All right, and we'll just shoot it that way. Okay, and a scaler. All right, coming to the home stretch. Okay, now let's try on our buddy. I'll take some flowable next. Get it in there. There we go. Get it to seat. Oh, off a little bit. Let's bring it back through where we need to go. That looks better. Mirror is next. Checking the lingual. Let's come down a little bit more. Backing it up. Oh, we're checking to see how that's all seated down. Looks pretty close. Looks good. Rocking it back and forth. Make sure it's down all the way before we loot it. Okay. Yep. That's down right in our position. That's in our wheelhouse. Okay. So we're going to add a little bit of flowable. Okay, light will come down. Explorer will be next. Transfer out. And more material next. Okay. Just so we can lock it in, folks. And then we'll get that lingual put in next. Yeah, it's a little complicated, but we're getting it done. Now we've got everything in. I think we'll end up just prepping off the jig. Leave it in there for now. Let's let it stay attached. That's good. It's in where it needs to be. Tooth's right where it needs to be. We'll check it with the mirror again. And now it's time to do the indirect technique. All right, mirror's next. I'm going to ask my dental assistant if she needs a break. Okay, she said no, thank you. My patient's all right? You doing good? All right. Put the light up, we're doing a check. Light up, please. Okay. Checking down below, that looks good. Tooth's right in the right position. Yep. Can't beat that. Oh, look good. Looks good. All right. Okay. Okay. So now we need to pre-soak this with our... Okay. So we need the visor seal. Hand it to doctor. Cotton plier. Pass. I need a black cover for this. And we're just going to wipe it. Not with cotton, not anymore. Oh no, I'm going to transfer out. There we go. Yep, you can have those. That one we need to cover. Upside down, just flip it. Yep. Okay. Okay, ribbons going in next. We're ready for our materials. So here we go. A1. So we need small. I'll show you how much to get out. Hand it to doctor. And I'll give me that. I'll just show you what I need, and then you can do the rest. Okay. Transfer, yeah. Okay, we're good? No. Okay, water. Okay, wipe. You all right? What's up? You need up? You're hurting? It's throbbing? You don't feel like it's in the right position? What? Well, okay, so I'm a canine over. 1, 2. That was number 23. That's the tooth I removed. And so now it's in the right position. It's slightly turned. You feel pressure on the left side. Oh, I have a clamp in there. Yeah, and I have a wedge over here. So I'm going to take the wedge out, and you probably feel better. So let me do that. Okay, let me get the wedge out. That feel a little bit better for you? Okay. Yeah, I'll double check everything. Just can't take it off, but the jig has locked it into the right position. So, yep. It went right back in the socket, so I'm good to go. Yep. That's one thing I just want to make sure I had everything seated properly, so it is. Okay. Instrument, gold. Okay, so wipe that. Something came off of it. Or my finger. Okay. So we need 6. Okay, so all you have to do is we'll get more material out now. Give me another squeeze like that. And we're going to take, I'll show you which ones to give me and pass me. Sometimes I have to use a little bit bigger. Okay, so that one. So we want them about that side, maybe a little less than that. I'll put that over here. So they gotta fit on the back of an incisor. So I'm estimating that one. This is another good one. You need two more. I'll take this one. And now the rest of them I might need plus or minus, and we'll go with this one. So let's draw a line here. I'm going to take these, but these are your reserve, okay? And then we'll need the same amount after we put the first layer in. We'll need a second layer to go on top of that, all right? And we like to use these kind of brushes too at the end, all right? We good? Okay, let's go. Small mirror. Light is now going down. Okay. All right, here we go. Hollenbeck's good, yeah. Okay. Can we go with a Hollenbeck on a transfer? And now I'm recognizing I need less, so I need your pad. And I'll take the Hollenbeck. And I'll show you how I need it. This end facing me. Let's get rid of that. Water. Okay. New Hollenbeck. Thank you. Okay. Other side, good? Yes, okay. I can just have it here in case I drop one. Thank you. And you're over there. I'm going to give you this back too big. So we're going to go smaller in size. Okay. Once we get the right size down, that's the kind of Explorer long. You okay? Small Explorer, please. Transfer. You all right? Okay, next piece. You can transfer it with an Explorer if you could, please. That's perfect. That's perfect. I just checked your model. It's in the right position perfectly. Small Explorer, please. These are too big, so we're going to go half the size. Next piece. use half of that. And then we'll duplicate that for the others. We have 4 to go. Next piece. Put it on a small explorer. I'll take it. Please. Transfer. Next piece. Next piece. And keep it coming. Gold instrument. Pre-dip, wipe. That will be with visor seal, not wet adhesive. Both ends. Both ends. Are they pre-dip? Both ends? Okay, here we go. Okay, looking good. Got the bed in there. Now we gotta put in the next piece. Okay, there you go. Cotton pliers. New cotton pliers on your end. Free of debris. Sorry for the reach. So you'll need more material like what we just used, but not right now. Okay. Now we're going to put in the ribond. We're going to go right in between the 2 central incisors, and we'll place our piece. We'll fold it to know exactly that's the midpoint. That's exactly the midpoint. Alright, and that goes right in the midline. So for counting teeth, 1, 2, 3, it's going to be right here. Are you okay? Long explorer. Small explorer. So now we're doing what we did on the model. In the mirror again. Doesn't matter. Now we're looking at positioning. And now we're pushing it into the material so it stays nicely. Oh, give me a plugger. Go back and forth with instruments. Now it's all about putting enough pressure on the material and then allowing the excess to be wrapped over on top of it, okay? So if we did everything right, and we Counted for the right length. Looks like I need to move it over just a little bit. There. There. Here. And then the final tucking on here. So see, it's right where we need to be. Alright, now we're not ready to wrap it yet. We'll wrap it in a minute. I'm just going to get this other side done, and then we'll wrap it. Explorer is next, small. So now we'll push down. Doing really well. Getting through it. There's our last tooth. We're right next door. There's our buddy. And there you got it. Right there. Okay, burnish or plugger. Okay. Now we'll always put more on this tooth. That's, the tooth that we have to keep in position. So that I'm going to load up later. But right now we want to get all these interproximal zones covered well. A little more focus on that. I'm looking at our time. We're right about 2 hours now, guys. 2 hours into it. 2 hours out of our 3-hour appointment. Actually missed the, you can relay to hygiene. I will not be breaking anymore for hygiene department. Thank you. Just tell her for the rest of the morning. Oh, that is? Oh my God. Oh, time flies when you're having fun. We're working over here, guys. Sorry. Should have been done by now, but we had a little extra to do here. Suturing, a lot of stuff going on. Okay. Explorer. Long. Yep. Now small pieces ready. You can have them ready. They'll be like small like last time. Explorers, please. So now, guys, I'm going to switch to direct vision. I'm still got you on video here, but large mirror, please. Yes. So here's where we are. So now I'm going to smooth all that down. Now we're going to, my dialysis is going to be transferring, and she's going to be wiping occasionally because we don't introduce like that. I'll get rid of that. Wipe now. Okay, so we'll start over here. Adding more material. Next piece, ready. Go gold instrument. Nope, just gold instrument. Okay, I need something to dip onto here. Have the next piece ready, and we're going to be going down the row here. So we're sandwiching in the ribbon. It's really the right way to do it. And thinning it as much as we can, but coating it. Looking at the surface texture, I need a good wipe or a new mirror, one or the other. Okay. Next piece. So we're moving from 27 to 26. We're going in reverse now. Here we go. Same instrument back. Same. Okay. And that's how we're Spreading it in, not too thick. So you use this tooth as a guide, and then you make it flush. Now the tongue's going to notice the thickness, but that's okay as long as it's smooth and contoured properly. That's the key, is the contour. Now we're running into our little buddies here, but that's okay. We can always polish as long as it's further away like that. I just moved it down. Transfer. This is tooth number 20. Have it on the end, please. I'll show you like this. Okay. And then I can place it like that and even manipulate it. Yeah. Okay, that's for you. Yeah, we're just going to play tennis now. You're going to bring the ball back and forth. Next piece ready. Let me know when it's ready. Okay. Crossing the midline. Keep it coming. Next piece. Okay. There's our champion. Let's have the Explorer back. Nothing on it. Small. Nothing on it. Small. We're getting there. Almost done. Hang in. It's perfect. We're not quite covered on this tooth. Maybe another piece. Yeah, back and forth. We're playing tennis. Yep. Oh boy. Okay. I intervene. Hi, Gail. Gonna be working through my lunch hour. Don't know where the end is. No more hygiene checks until notice. Thank you. Have a nice lunch. She doesn't have the earpiece in. She probably does. Nicole or Tyler, can you go help out, please? Thanks. Tyler or Nicole, thank you. Can you communicate for me, please, in my presence? I really appreciate it. Thank you. Okay. Sorry for the interruption, folks. Hygiene duty calls, but I can't go. I can't leave us now. Thank you so much. Appreciate it. Great team. Thanks. All right, Kyle, you're on call. If we need something, we'll call you, okay, buddy? Thank you. Did I say Kyle? Kyle. I did say Kyle. Kyle, do you have your headset on, Kyle? Could you get with the program, sir? Let's go. He's a good soldier out there. He's a good buddy. Going to dental school soon, right, buddy? Yeah, dental school. Okay, good, good. One more piece, please. All right, here we go. Finale. Okay. Okay. Now, I need some more fresh material right here. Same stuff. We good? Okay. Now I'm going to take my finger and just kind of rub it a little bit. Right? Kind of keeps it nice and smooth. Get a nice surface. Going to keep rubbing. More material, please. Thank you. On the glove. Okay. Looks great. I'm going to cover a spot. Small piece of material on the end of an Explorer. Standing by. Okay, Now, small explorer. No material. Small explorer. Okay. Now, I'm going to go underneath and pick it up a little bit like this. Okay? I'm just going to pick it up a little bit like that. We look like we're covered there. Pick it up here. We're going to allow our partner here to have room in between. We're going to pre-wipe that. And again, wipe that, please. Okay. Alright, we're going to clear all that top portion and we'll add, subtract, whatever we have to do. Alright, we are ready to cure this. Nice of you to join us, Kyle. Okay. So, the bed is laid. The material is in. We are assembled. Now, I said before we have to kind of prep this off this jig, if you will. So you can see how that grabbed it like a hand, like fingers on a hand. It's a scaffold. We're building a scaffold. We're building a support. And then we're going to be add, subtract in certain areas. All right. Again, the tongue is going to feel it. It'll be nice and polished, highly polished. But again, it's a brace, a strong brace. And then we'll transfer out. Light can now come up. And now we can visualize and inspect. Do we need to add? Yes, we will add some more material to the middle tooth. We'll do that now. Light will go down. And we're going to add. Let's see one spot in here I think we can benefit for a little bit more material. Otherwise, success. Good. Yep, on an Explorer. Perfect. Now I'm going to add it right there. This is we have to make this more durable. So we'll then coat that. More material. Coming up almost an hour. Actually, we've been at it for 2 hours, folks. 2 hours and 8 minutes. I'll need a good wipe or a new mirror. One or the other. Wipe or mirror. Okay. Okay, let's go with my finger down in there. So I'm turning my wrist as I do this, just going up against it. And now that's got a nice shiny surface. We'll wipe that. Alright. Proximal areas for, I think we'll go with one more piece. Yep. So I'm just going to bring it down. I'm going to give it a little more support. I really want to give him a little more support in here too, right in the midline. He's got lots of room to floss through, lots of room to use his water pick. I'm just going to plug it right there. So see, I'm confident, but I'm not worried about moving anything, you know. And the thickness can be controlled easily, much more easily now. All right, there you go. All right. Again, I'll do a wipe, and then we're ready to do a final cure from the lingual, and then we're going to come around and check everything from the labial. I'll take the Explorer again. Okay. Proximal zone. Proximal zone. Looks happy. Let's get it. 2 hours, 8 minutes and counting. Covered all the bases. Think about a fence. You know, when you put posts in a fence and you're stringing a cyclone fence together, you want to tie it tight, get it right. The more posts you have, the stronger that fence is going to be. So he's got 6 teeth in here, all acting as one right now. So imagine putting that strength together. It's like putting a team together with pulling the pulling the tug of war rope up and back. Okay, so scalar is next. All right, scalar is next. We're going to lift a little bit on each tooth, a little bit. Might break a little bit of the blue material away. That's okay. I'm not worried about that. So it's coming up slowly. Slowly here. That side's loose. Now it's the middle portion. And we may just prep that with our handpiece. All right. New burrs. Let's go thin, crispy. Extra crispy thin. Okay. We're picking burrs out. All right, so bring your chin down a little bit. Thank you, sir. We're just going to get rid of some of this scaffolding now. It's done its job, getting rid of it. We're thinning it down. The dental system will be drying off the area. She might even introduce no water, just drying now. All right, Heather, we're almost done with that. Looks good. Now let's see if it pops off on its own. Yeah. All right, there it goes. Nice and strong. All right, here we go. Lifting. Yep. Nope. Yep. It's coming. Other side. Lifting. So it is bondable material. That's why it's kind of sticking a little bit, but that's okay. Got a little bit here too. There we go. All right. I just don't want to introduce water right now because we've worked so hard to get the bond strength where we want it. If we have to add, we'd rather add to an environment. All right. Handpiece, smaller burr. Smaller burr. Hard to see. There we go. Every case is different. Just the way the nature of the biz here. All right, and there's our tooth. Turn to your left. Very good. So now what we're going to do is polish. Okay. All right, here we are. We're going to use a finishing burr, and I'm going to change gloves again. We're not using any water. Try to keep the environment nice and dry. In case we have to add a little bit from the facial aspect, sometimes we do that. Kind of wrap things in there so they're stronger. All right, here we go. We're back. Okay, okay to add air. So we're just reducing enough to get rid of the blue material. It just became a part of the... There we go. You can see that was abutted right up against the tooth, so that proves we were seated perfectly. Okay. So there's a lot of surface area that's covered when you're doing a case like this. So tons of surface area covered. Again, we've laid it in fairly thick. We just keep it like that. We're going to use a larger mirror now to look inside and see what's going on. And we can see our uniform thickness throughout. And a nice polished surface. So now I can use these polishers that we have. But let's look at the labial aspect. Plus or minus labial. Fine diamond will be next. Super fine diamond. Looks like we've got one right here. Okay, we can throw that there. I got one here too. We're good. Super fine, going on the labial surface. And this was the original material that we used, the flowable, just to tack it in place to make sure it wouldn't walk around on us. Up or down, we're good. Okay. Where it all began. So he'll brush his teeth like normal teeth. He's going to use the tip of the water pick to go in between, but he won't be doing that for at least a week. You want that plug the heel in there. You don't want anything to change. Give him some post-op instructions. Okay, now I'm going to look from the facial aspect and grab a mirror for that. Okay. I like it. I like the way that's hugs in there, and it's got a nice angle on it, nice thickness to it. Hopefully it won't debond. But so what we can do is we could add, although we have material that did go in between interprox, so we gotta make sure this tooth doesn't bother the occlusion at all. It needs to be out of occlusion completely. So it's kind of like a Maryland tooth, but it has to be out of occlusion. Alright. A little maintenance over time. Dentist up there in his hometown can add a little bit every time he comes in for a cleaning. They can just check it, make sure it's good. Alright. We're going to super cure it, so we don't need to go in any further. Super curing. This tooth locks it in facially from going that way. This side, maybe a little more. Looks like I have some out there. I'm going to leave well enough alone. That looks good. I'll run with that one. I'm going to leave well enough alone. What do you think, Heather? Good? Pretty neat stuff. Long appointment, though. Okay, good. Went by quick, she said. Super curing is just putting a hedge on your bed, I guess, the old saying goes. Tongue's going to get used to it. Takes a little time. I just keep telling the patients the alternative is such a dramatic restorative responsibility. I mean, we're eventually going that way, but if we can slow it down, 5, 10 years would be nice. If it's shorter than that. Incidentally, if a tooth were to be a problem like some of these other teeth, you can leave the splint in place and just go from underneath. The surgeon can round off the tip of the root, through an open procedure. So he's got some good options with a good probably a periodontist will take care of his needs. Long appointment here. Try to give every tooth equal time on the bonding. Everybody gets equal time. All right, Heather, I think at this point we can rinse everything off gently. I won't want to rinse out of the socket, but I'm just going to rinse off the necks of the teeth. We'll get the rubber dam off, check occlusion, and we can actually I'll polish it a little bit. All right, I don't see any weak areas anywhere. It all looks good. I'm happy with that. I just look at it from a perspective from above. Yeah, it's good. Okay, circular polisher for me. Got one right here. Circular polisher, and then the blue. Polishing now. Sorry. I'd add a dash of flowable in areas. Light, perhaps. We'll see. We'll see how it comes out. I might. Just thinking out loud for now. I'm going to go over this one. Just you don't need a cover on this. I'm just going to do a no look. You need Kyle for anything? Okay. All right. I'll just switch over to our high shine. High shine it is. All right. Okay. I gotta go back and forth a little bit. Well, that's it. That's the polish, and soon to take the rubber dam off. Looks great. Polish that out just a hair more. Tiny bit. Yep. A little bit of that blue is bugging me. Oh, we had it wrapped in there nice, didn't we? Okay. All right. I'm going to use a little visor seal on a brush, small brush. Okay. Okay, and we'll give it a final coating on the lingual. This is like a sealer. Give it a good coat around seams, any seams that look like they need it. Nice coat. Alright. Looks good. Give it a light dry in here. There we go. Now we'll take the rubber dam off, check occlusion. Now some of the other teeth may feel like, because they don't move, like they're hitting high in the mouth. So that is normal. And so we'll do a nice adjustment. We might have to do a opposing arch adjustment. But we got our tooth right back in the same position. So nobody will notice. Actually, you really can't tell from just looking at one's tooth. Clamp holder, light up. Transferring, going out left. Clamp holder back. Okay. All right. Good job, my friend. You made it. Transferring left. Paper ready. All right, so there you have it. We're just going to adjust the bite, but that's what it looks like. Close up together, please. Bite together. So there it is. Not much adjusting to do, really. Tongue's going to have a little bit of fun, but we'll see you all next time. Thanks for watching. Sorry it was a long one today. As soon as I find my mouse, I can turn off the video. All right, see you all next time. Take care. How you feeling? Good? Awesome. Yeah, we're going to do the bite now.